Welcome to the fascinating world of general surgery. This field is a cornerstone of medical practice. For many aspiring doctors, it is where the journey truly begins. General surgery introduces you to the core principles of patient care in a very direct way. It teaches you about diagnosis, decision-making, and the profound impact of intervention. Think of it as the bedrock upon which many specialized surgical skills are built. Understanding general surgery will serve you well, no matter which medical path you ultimately choose. General surgery encompasses a wide array of conditions and procedures. You will encounter patients with common ailments like appendicitis, hernias, and gallbladder disease. You will also learn about managing trauma and critical care situations. This breadth of experience is incredibly valuable for any student in the operating room. It provides a comprehensive overview of surgical problem solving. Mastering the fundamentals of general surgery builds immense confidence. Your understanding of human anatomy will deepen significantly with each case observed and assisted. The manual dexterity and technical skills you begin to develop are transferable. For OR students, general surgery is where theoretical knowledge vividly transforms into practical application. You are no longer just reading about anatomy in textbooks, you are seeing it in real time, in living patients. This direct hands-on exposure is truly transformative. Preparation is the absolute bedrock of successful surgery. This critical phase begins long before the patient even enters the operating room. Thorough and meticulous preparation is paramount for ensuring patient safety. It also plays a significant role in optimizing surgical outcomes and minimizing potential complications. As a student, you must never underestimate the importance of this crucial stage. Your preparation starts with a deep understanding of the patient. You must diligently review their complete medical history. Take note of any pre-existing conditions, previous surgeries, and current medications. Allergies are particularly important to identify and highlight. It is vital to discuss the case thoroughly with your attending surgeon and the rest of the surgical team. Do not hesitate to ask questions. Clarify any doubts you might have about the patient's condition or the planned procedure. This proactive approach demonstrates your commitment and helps prevent errors. Next, you must familiarize yourself intimately with the planned surgical procedure. Read about the specific steps involved from start to finish. Study relevant anatomical diagrams and visualize the surgical field in your mind. Knowing what to expect significantly reduces your own anxiety. Surgical instruments are essentially extensions of the surgeon's hands, eyes, and skill. Each tool has been meticulously designed for a very specific purpose. Learning to identify and understand these instruments is like learning a new, intricate language. It requires patience, dedication, and consistent practice. Pay close attention during every procedure you observe or assist in. Notice which instrument is used for which task. Observe how it is handled. You will quickly become familiar with a core set of instruments. Scalpels with their sharp blades are used for making precise incisions. Forceps, which come in various shapes and sizes, are essential for grasping and holding tissues gently but firmly. Hemostats, often called clamps, are crucial for controlling bleeding by clamping blood vessels. Retractors are used to hold tissues and organs aside, providing the surgeon with a clear view of the surgical field. Surgical scissors are designed for cutting sutures and delicate tissues with accuracy. Proper instrument handling is not just about speed, it is fundamentally about safety and minimizing tissue trauma. It is a skill that develops over time with deliberate practice and keen observation. The operating room environment can initially feel quite intimidating for students. There is an immense to absorb. You might feel overwhelmed by the fast pace, the unfamiliar terminology, and the gravity of the procedures. Please know that this is a completely normal part of the learning process. Every skilled surgeon, every experienced nurse was once a beginner standing in your shoes. Acknowledge your feelings, but do not let them deter you. Embrace the challenge as an opportunity for profound growth. One of the most common challenges students face is information overload. You are bombarded with new terms, complex procedures, and intricate protocols. The key is to break it down into manageable pieces. Set a realistic goal of learning 1 or 2 new things each day. Keep a small pocket notebook handy to jot down important terms, instrument names, or questions that arise. Review your notes regularly. The physical demands of the OR can also be a challenge. Standing for long hours, often in one position, can be tiring. Invest in comfortable, supportive footwear. It makes a significant difference. Remember to stay hydrated throughout the day. The fear of making a mistake is another significant hurdle for many students. Clear communication with the entire team is vital. Section 5. Stories from the sterile field. Lessons beyond the books. Textbooks and lectures provide an essential foundation of medical knowledge. They give you the scientific principles and the established protocols. However, some of the most profound and lasting learning in medicine, especially in surgery, happens through direct experience. Each patient encounter, each unique surgical case tells a compelling story. These real-world stories are rich with invaluable lessons that go far beyond what any book can teach. It is crucial to listen attentively and observe every detail with a curious mind. These experiences will shape your clinical judgment. I vividly recall a young medical student who was understandably quite nervous during their first major abdominal surgery. The attending surgeon, a seasoned veteran, noticed the student's apprehension. Instead of being critical, the surgeon calmly and patiently guided the student through each step. The surgeon explained the rationale behind every maneuver, turning a moment of anxiety into a powerful learning opportunity. That student, inspired by this mentorship, is now a confident and skilled surgeon. On another occasion, during a seemingly routine procedure, unexpected and significant bleeding suddenly occurred. The atmosphere in the OR became instantly charged. The situation was brought under control swiftly. Section 6. Teamwork in action, your vital role as an OR student. Surgery is a team sport. Every member of the team plays a critical role. This includes you, the student. You are an active part of this skilled team. Your contributions matter to the procedure's success. Learn actively and assist effectively. Be proactive in your learning. Read about the procedure and anatomy. Anticipate the needs of the surgeon. Have the correct instrument ready. Help with retraction or manage suction. Your attentiveness contributes to the operation. Clear communication is paramount. Speak clearly and professionally. Open communication fosters safety. Section 7. Sharpening your skills. The path of continuous surgical growth. Mastering general surgery is a continuous, lifelong journey of learning and refinement. Medicine and surgery are constantly evolving with new research, techniques, and technologies. Embrace lifelong learning to provide the best care for your patients. Seek regular feedback from preceptors and senior surgeons. Practice fundamental skills whenever possible. Repetition builds muscle memory and refines motor skills. Section 8. The surgeon's mindset. Building focus and emotional strength. Performing surgery demands an extraordinary level of intense focus and unwavering concentration. As a surgeon, or as a student aspiring to be one, you need to be fully present in the moment, especially during critical phases of an operation. Learn to minimize internal and external distractions. Developing the ability to maintain your attention for extended periods is a skill that, like any other, improves with consistent practice and experience. This mental discipline is as important as any technical skill you will acquire in the operating room. Emotional resilience is an equally vital component of the surgeon's mindset. You will inevitably encounter highly stressful situations in the operating room. There will be complex cases with unexpected challenges, and sometimes, despite everyone's best efforts, there will be unfavorable patient outcomes. It is crucial to develop healthy ways to manage your emotions effectively. Acknowledge your feelings, but do not let them overwhelm you. Debriefing with your team, a trusted mentor, or a counselor can be incredibly helpful in processing difficult experiences. Develop healthy coping mechanisms to manage the inherent stress of a surgical career. Regular physical exercise, mindfulness practices, meditation, or engaging in hobbies outside of medicine can provide much-needed balance and perspective. Ensure that you prioritize adequate rest and sleep. Section 9. Embarking on your surgical path. Core principles for success. Your journey into general surgery is an exciting and pivotal time. This field offers unparalleled opportunities for growth. Remember the core principles: meticulous preparation, diligence in your studies, and a thirst for knowledge. These tenets guide you through a surgical career. Embrace every learning opportunity. Be an active participant in the operating room. Ask thoughtful questions. Show initiative and volunteer for tasks. Your enthusiasm will be noticed. This attitude opens doors for mentorship. Never lose sight of the patient. They are the reason you are here. Patients entrust you with their lives. Treat this responsibility with utmost seriousness. Approach your work with dedication, honesty, and integrity.